Welcome to the June 30th update, looking at the coronavirus situation, comparing that to the IHME forecasting model and looking at some other analysis. My name is Alan Featherstone, and this is work done in conjunction with Jonathan Featherstone and Julia Maddock. There were two revisions to the IHME model since June 23rd. And so we will provide a little bit of a discussion in terms of what those revisions ended up doing. The second thing we're going to look at is the projected death through August 4th. We're going to again take a look at the Kansas and United States mortality statistics, just to provide an update on those over the last week. Then we'll focus on the distribution of daily deaths compared to the original March 26 model. And then in the appendix of this presentation, and if you want to take a look at these, we're not going to go over these within the presentation, but if you want to take a look at the slides, we will have the cumulative death figures charts compared to the March 26 model. And so if you want to take a look at the U.S. or an individual state, you can take a look at those on agmanager.info in order to get the slides. Again, as we're well aware, the COVID-19 virus is certainly having a major effect on the U.S. economy, with an unemployment rate of 13% given the most recent numbers. Since the middle of March, more than 45 million U.S. workers have filed for unemployment due to the shutdown of a significant share of the economy. The IHME model from the University of Washington certainly has played a big role in the formulation of policy. And if you want to look at the information, that's from health.org/COVID. And the actual death data that we're using is from the COVID tracking project. And so if you want to take a look at the individual numerical numbers, the actual death data, both daily death and cumulative death, we are taking from the COVID tracking project. Again, it's important to really understand the revisions and what's going on, and we're in a situation now where we're seeing more diagnoses of individuals that have COVID-19, but in some respects there is a paradox going on, and we'll get into that as we look at the analysis. But the paradox is that the deaths are still going down, and so it will really be interesting to look at over the next couple weeks in terms of whether or not the number of deaths continue to go down, even as the number of diagnoses is increasing. And certainly if that does, it's going to lead to a policy question with regards to whether or not the policies that we're instituting in individual states and as a nation, whether or not the goal is to limit the number of deaths and essentially make sure that people that have the disease are treated and brought back to health with not having a significantly high death rate, or whether or not the goal of the policy is to reduce the number of infections. And if the number of infections are going up and the death rate is going down, in some respects, basically, it means that the virus may not be quite as destructive as it was originally, or the other aspect is over time our healthcare system within the U.S. has essentially adjusted their treatment policy to be able to have better outcomes for those that are diagnosed with the disease. This is an update of the June 23rd discussion. In terms of the big thing that occurred in the last week is kind of down in this fifth or sixth and seventh bullet point. In terms of the model now that the University of Washington is doing is they're providing estimates based upon what is expected to happen, and then a situation where mandates are easing, and then estimates with a 95% of the population wearing masks. And what's going on there is essentially they're using a switch to essentially adjust for policy. And what they're doing is they're going to allow the easing to continue until there's a daily death rate of 8 individuals per million. And so once that occurs, then they will argue that governments will end up closing down and adding more restrictions, and so limiting some of the freedoms with regards to opening the economy. And so this 8 per million is really key. And so to do a little bit of analysis here to give you a feel for that, in Kansas, 8 persons per million dying per day would be, in Kansas, 22.4 deaths per day. In the U.S., 8 per million would be 2,605. And so essentially how you would calculate this for your own state is take the population, divide that by a million, and multiply that by 8 would essentially look at this. The other thing I think that is important to realize is the paper is still in peer-reviewed process, and so it hasn't cleared the peer review process. And so, again, I think it's just important to realize that certainly it's quite often that analysis is used in policy making without it ever clearing the peer review process. Looking at this, essentially in the last week in Kansas, we've moved up to 270 deaths. And so, again, you can see the distribution of those deaths. Normally, 97.6% of the mortality in Kansas, at least from 2018, is individuals 25 years and older. You can kind of see the distribution there, where 1.8% is essentially in that 25 to 34 range. If you look at COVID, looking at this in terms of, again, same type of thing that we've seen in previous months, a little higher death rate in the 85 plus, in the 65 to 74, in the 55 to 64 in Kansas, and the other areas are a little bit less. If we look at those numbers from the U.S. perspective, again, one of the things you see probably more clearly in Kansas is that essentially the mortality is a little higher than the average mortality for years 65 and older. If you get less than 65, it's a little bit less. And so in 55 to 64, COVID is roughly 11.9%, and the 2017 mortality rates are 13.2%. Total deaths that the CDC reports, and you have the link there, is 108,000, and so just short of that. Again, the numbers are a little bit different than are reported on some of the other websites, such as the statistics released by the COVID tracking project, and then also with regards to world info meters. And so you do see some differences there. Part of it may be from a reporting, and then part of it just may be from a timing basis. If we look at this with regards to deaths per thousand, again, at the end of June, we've probably are on about 4 months of this, and you can kind of look at what the deaths are per thousand. Again, there's a lot of newspaper coverage on this, but if you look at these, you can see that they're orders of magnitude of 100, and so roughly 1% of the death that we've had from COVID is about 1% of the mortality rate we would see on an annual basis. And again, you can multiply this by 3 or 4, and I certainly wouldn't argue with that. But I think it's important to realize that there's a big focus on this coronavirus, and certainly rightfully so, but it is important to realize that there's a lot of other reasons why people die rather than the coronavirus. We can also look at this from the U.S. perspective, same type of thing in terms of many of these. The factors are substantially less with regards to that, and so certainly that's an important thing to consider. In terms of moving forward, this next slide here basically looks at the revisions, essentially projected August 4th deaths from March 26th, June 15th, June 24th, and June 29th. And so again, we are taking a look at this. And so essentially we have the different states there and where we are. In terms of the June 6th or June 15th model for Alabama had 1,943 deaths. The June 24th model had 1,415, and the June 29th had 1,395 as a cumulative death projection. You can look at Kansas. The original projection was 687. 2 weeks ago it was 342, and so in Kansas you can essentially see that nothing has changed. But in other areas, for example Illinois, the original was 2360, and then it went to 2489, then 7814, then 7936. And so over the last 2 weeks, the projection of death within Illinois has essentially increased by 500. Kind of looking at some other states, again, these are the numbers from this IHME model over time, and again you can see some differences in terms of, for example, New Jersey, you're seeing an increase. In terms of Nebraska, was fairly level. Oklahoma, you're seeing a decrease, and so certainly you do see these over time. In terms of looking at this from the U.S. perspective, the original model was 82,000 as of June 15th. On August 4th, it was right at 150,000. It dropped to 145,000 with the June 24th release, and then essentially it dropped to or increased to 148,000 at the end of the June. And so you can certainly take a look at that. And so to maybe summarize this, the model revision released just a couple days ago. The cumulative expected death increased in 21 states and fell in 29 states from the June 15th model. And so you can look at the states that are increasing: Connecticut, Delaware, Hawaii, Idaho, Illinois, Kansas, Louisiana, Massachusetts, Mississippi, Missouri, Montana, Nebraska, Nevada, Ohio, Rhode Island, South Dakota, Texas, Vermont, Virginia, Washington, Wyoming. In terms of, again, it's important to realize, for example, Kansas saw an increase, but that cumulative difference was one individual. And so certainly you can make a big an inference that certainly there has been some increase, but you really have to look at the numbers. And then if you look at where we are at the end of June 29th, compared to what the original model was, essentially 23 states have higher expected death expectations and 27 are lower. And so again, you have the list of states there if you want to take a look at that. But certainly that is important to look at in terms of assessing the accuracy of the original model. One of the things that we ended up doing differently this week is we actually did some trend analysis and daily death for the month of June. And so we estimated just a trend model and looking at, okay, how does this change on a daily basis? And the numbers in green basically indicate that over the month of June, there was actually an increase in death. And so, for example, Arizona here at 0.41, you multiply that by 30 days, and that would end up indicating that Arizona has essentially seen an increase in deaths of about 12 per day. And so you can multiply these numbers by 30 to look at that. Conversely, in terms of looking at Illinois, multiply that number by 30, and essentially over the month of June there was a downward trend of 75 individuals. And what this does is smooth some of this in these graphs that we've looked at before and that we'll look at into the future. And then states like Nebraska, for example, there's no trend. One of the things I think to realize is that these may not be statistically significant, but what those are is just the change in death per day. Looking at Kansas in terms of multiplying that by 30, essentially the death from the beginning of June to end of the June on a daily basis decreased 2.1 per day. And so certainly looking at the red, they're seeing an improvement in the situation where they're seeing less mortality due to COVID. The numbers in green are positive. In some respects, New Jersey is an outlier, and we'll show this. The one day towards the end of the month, they ended up adding additional information from deaths that occurred previously. They weren't smooth, but what that does is it really messes up your trend, and so those are certainly there. And so to maybe summarize, 32 states since June 1 have had a decrease in the daily rate of death. 13 states have had an increase, and then 5 states have essentially seen anything. If you look at these numbers for the U.S. as a whole, essentially it's 5.76 decrease per day in deaths. And so you would multiply that by 30, let's say it's 6. Essentially, at the end of June, following the trend, we would roughly be seeing 180 deaths less per day than we were at the beginning of June. And so these next graphs here that we're going to go over, we're going to take a look at those in order to look at this. And this, in some respects, is the New Jersey influence. And so it's probably pulled this up a little bit in terms of the trend analysis for the U.S. But again, you can see towards the last week, you can see that downward trend. It is higher than the original projections, and we'll come back and look at that later. And so certainly we will take a look at that. In terms of Kansas, you can take a look at Kansas, and again, you can end up seeing that it is bouncing around, looks fairly level. Colorado continues to drop. In terms of it, it seems like Nebraska has been fairly flat. It's been up, it's been down. In terms of Missouri, if you look at the trend lines, actually there's some progress being made in Missouri with regards to a downward trend. Oklahoma, in terms of the trend numbers there, were basically no trend was observed, and so you can see that over time. New York ends up having a downward trend, a fairly strong downward trend. Basically, as each day passes, their number of deaths is decreasing by about 1.8 per day. This is the New Jersey story where they added a lot of deaths that should have been classified as COVID earlier. At some point, those will probably be put into the trend data. Again, looking at this in terms of what the expectations, you can see that the situation in New Jersey was much worse. Again, Connecticut has seen some progress through the month of June. Same with Massachusetts. They're decreasing about 1.8 deaths per day. Maryland through the month of June is looking at a decrease also over time there, essentially about a half a person per day. Delaware, Rhode Island, New Hampshire, Again, then we're in Vermont. Again, very good situation. They've essentially had one death in the month of June. Maine, again, has been very low for the entire period. Pennsylvania basically over the month of June has decreased the number of deaths about 1.5 individuals per day. Ohio has made good progress, about 0.9 individuals per day through the month of June. Michigan is essentially making progress, about 0.3 individuals per day reduction in death. Indiana continues to do well, about 0.6 days or less death per day through the month of June. Illinois has been making progress with regards to looking at this. Essentially, through the month of June, they've had a decrease of 2.5 deaths per day. Iowa is making good progress through June in terms of Iowa is about 0.3 individuals per day less. Minnesota continues a downward trend. Wisconsin, and so the upper Midwest, in some respects, if you would draw a conclusion there, is essentially they've experienced a much bigger purchase or much better success in terms of reducing death. Now we're going to move into the Southeast. Certainly the Southeast are places where we're looking at increased diagnoses. And so I think it's going to be very important to take a look at the death numbers over time and just see whether or not the healthcare system is able to work with those individuals and restore their health. In terms of Florida, if you look at the month, again, it is a slight negative, very close to flat, but certainly with the increased cases so far, there hasn't been an increase in death. Georgia, through the month of June, about negative 0.6. South Carolina, through the month of June, actually has seen a little bit of an uptick of 0.02. And so if you would multiply that by 30, essentially, that would end up being about 1 individual per day, or 0.6 individuals per day. North Carolina has a negative 0.019 trend. Virginia has a 0.03 positive trend, so there's a little bit of an uptick in June for Virginia. West Virginia has a negative 0.03, again, has weathered COVID very well as a state. Kentucky, in terms of Kentucky, has a negative 0.09, and so while there has been a bit of an uptick, it's overall been going negative. Tennessee ends up a slight negative. Alabama, if you look at Alabama, that actually has a 0.01 uptick, and so very, very level. Mississippi, from a death perspective, has had a negative 0.03. Louisiana has had a situation where their trend through June is negative 0.4. And so looking at essentially what's going on in the Southeast, essentially if I had to characterize what's going on there, their death has been flat over that period of time. Texas essentially has had an uptick in death, 0.33 per day. And so if you would multiply that by 30 days, essentially the trend would essentially increase the amount of death by essentially about a total of 10 individuals per day from the beginning of June to the end of June in terms of their death. New Mexico continues to decrease. Arizona, another hot spot with regards to the situation there. Their trend is a positive 0.41, and so they are seeing more death at the end of June than they did at the beginning. Utah, very flat, slight negative. Wyoming, very flat, a little bit negative. Montana, in terms of roughly 0. North Dakota, looking at North Dakota, a negative trend. South Dakota, a positive trend, but again, you're looking at pretty low numbers. Idaho, you're looking at those, and if you look at the trend there, pretty much 0. Nevada, in terms of certainly seeing a bit of a decrease. And so looking at the Great Plains and some of the West, essentially you're seeing a bit of an improvement or level within that part of the states. California has a bit of an uptick in terms of death at 0.03. Oregon has a situation of a uptick of 0.01, and then if you look at Washington, 0.03. And so if you look at the 3 western states, California, Washington, and Oregon, essentially through the month of June, the trend has been up in each of those states. It's been very small, and so you're looking at 0.03, and so you multiply that 30, it's increase at the end of June compared to the beginning of 1 death per day difference. But certainly that's there. Then we look at Alaska, again very flat, virtually 0. There were 2 deaths reported one day, and that actually makes that trend up, and certainly not statistically significant, but it does show in terms of what very small numbers can end up doing. Hawaii, again, hadn't had any deaths until the end, and so when you put that in on the trend analysis, that actually makes it look like a positive trend, but that's probably not fair. And so looking at this, if we end up comparing the June 29th cumulative deaths with the original projections, kind of using those green bars that are the confidence intervals, both the lower and the upper bound, then we have the estimated, and then we have the actual. Essentially, there's 12 states above the mean in terms of Connecticut, Illinois, Indiana, Iowa, Maryland, Massachusetts, Michigan, New Jersey, New York, Ohio, Pennsylvania, Rhode Island. Again, these are states that essentially are outside that original confidence interval on the negative side. Basically, that indicates that their experience with COVID was much worse than what was originally expected, and so much more worse that they're out of the 95% confidence interval reported. 5 states are above the mean, but within the 95% confidence interval, and from last week we added 2 to this categorization, Georgia and New Hampshire, and so they've had more than the mean from the original model, but still within that 95% confidence interval. We have 19 states that are below the mean, but within the 95% confidence interval. You can take a look at those there. And then we have 14 states that are below the mean and below the 95% confidence interval. And so these are states where the original projections were way high. And there are 14 states. Many of those are spread around, but certainly some of the western states, some of the Midwestern or Great Plains region were in that group. To conclude, essentially the model continues to be revised, and it's important to have an understanding of what's going on here. In the last 2 weeks, essentially the expected cumulative death statistics have been reduced in more states than increased. And so again, while the projections or while the diagnoses have increased, the death has actually decreased. And so we're seeing more states being reduced in the projections than increased. And we're also looking at that distribution. It tends to be similar. And then if you look at the trend analysis and daily death, essentially there continues to be good news on that front. And so again, it's important really, I think, to take a look at that. Through the month of June, 35 states have had a decreasing trend for daily deaths. 13 have experienced an increasing trend. And so certainly that is there. In terms of if we look at the U.S. cumulative death total through June 22nd, it's above the mean, but certainly it's within the range. And in terms of the other thing I think that we didn't focus too much on with regards to revising the model from the IHME standpoint is when we end up taking a look at these situations, 8 deaths per million. For example, for the U.S. as a whole, that's 2,600 deaths per day. According to the COVID tracking project, that's only been 2 days since the beginning of this where we've had that amount of death. In Kansas, that number's 22 per day, and if you look at the distributions in Kansas, that was 0. So again, we appreciate your effort here. I apologize for the phone ringing, but hopefully this provides you some information to think about and just have a better understanding of what's going on with the numbers. With that, we hope to be back next week. Have a good week, and hopefully we'll see you next week.